And then the third part of it has to do with those people who are not well served by the system now. You've got the 80-some% who have private insurance, and another 10% or so who have Medicare. VA, by the way, is essentially untouched by this. It would continue as it is, VA care. But there are 10 or so percent of the country who don't have health insurance or work for companies that can't, are going to have to give up their health insurance, have either already given it up or are about to. These people are not well served by the system, and so the question is, how can they get health insurance that's affordable to them? That's what, small businesses, whether employees or owners, come to me all the time and ask, where can I get affordable insurance? Why won't you let me purchase insurance at group rates? Well, that's what this bill does. It takes the tens of millions of people who currently don't have health insurance and puts them into a large pool. And insurance companies can then write healthcare policies for the people in that pool, either as individuals or as employees of small businesses. So a small business or an individual, that individual might be an individual contractor or an entrepreneur, it might be somebody who's between jobs, can purchase insurance at group rates. For years, the small business people have been asking me, why can't we pool with other small businesses so we'll have a risk pool of 1,000 employees and we can get lower rates than we can get for a risk pool of only 12 employees in my company. Well, this is even better because you get a risk pool of millions of people. And this should be very attractive to insurance companies. These are people who will be paying premiums with assistance from the government, depending on their ability to pay. It will be a very diverse group of people. It will not be a particularly sick or high-risk group. And so insurance companies probably will offer good rates, good group rates for this group. However, it's not clear we can trust the insurance companies to keep their rates down. And that's where this so-called public option is. One of the items in this insurance marketplace, for this 10% of Americans who aren't currently served by the system, one of the choices there, and that's why it's called an option, would be a nonprofit insurance plan run by the government. It might be somewhat similar to Medicare, for example. It would really be more similar to what's offered by Aetna or Verizon or any of the various companies around the country. It would be more similar to one of those policies. However, it would be nonprofit. It wouldn't have to pay shareholders. It wouldn't have to show a profit at the end of the year. It would have to abide by the same standards. When I say any insurance company has to meet these national standards, the national standards not only include not refusing people for an existing condition, but also requires some things about capital set aside and to cover the costs of insurance and that sort of thing. This public company would have to abide by all of those same requirements and regulations, but presumably would be offering insurance at somewhat less than the private companies would. Why do we think that? Well, because the private companies have a very high overhead. One of the suggestions in this legislation is to offer something that would require that each insurance company in America spend at least 85% of your premium dollar on actually providing health care. And they're squawking about that. Now, 85% of your premium dollar going to your actual health care doesn't seem excessive. Doesn't to me, anyway. But in fact, they're spending quite a bit less than that on your health care. It's kind of 80-ish%, sometimes in the 70s. What does it go for? Well, it goes for salaries, corporate jets, marketing, profits, so forth. Medicare is a very efficient program. About 97%, or 97 cents on the dollar, in Medicare go to the health care of the Medicare beneficiaries. With great patient satisfaction and actually good doctor satisfaction. I won't say great doctor satisfaction, but good doctor satisfaction. Medicare works. Now, I can hear what's going on in your minds because I get the letters about this. No, Medicare doesn't work. Medicare is going to go broke in a few years, right? That's what some of you are thinking.
We're going broke.
The point is, at 10% a year inflation, where medical costs are going up at 2 or 3 times the cost of living, or the cost of your salary increases, no one, no private company, no government insurance plan can remain solvent. It's not Medicare that's in trouble. It is healthcare in America that is in trouble. Medicare is not in worse shape than anybody else. It's just that you know Medicare's situation because it is public. Their books are open to the public. We know that at the current rate, in a decade or two, by the way, this plan would extend the solvency of Medicare for another 5 years, as best estimated by the Medicare fiducial board. But, you know, in a decade or two, Medicare will be in trouble. But at this rate of inflation, so will any other insurance company. That's why we have to do something to hold down the escalation of the cost of medicine and healthcare in America. There are a few things in the bill that will tend to do that. Holt will do that. Moving away from a procedure-based toward a patient-based medical system would do that. And the public option would tend to do that. Now remember, the public option is just a choice that some not even 10% of Americans would be choosing. But it should provide a competition that will exert downward pressure on the costs. That's the point. Now, there are a number of other things in the bill to provide scholarship money and loan forgiveness for students who want to go into primary care medicine. There's funding in there to train nurse faculty members, because that's a real bottleneck in our system. There are not enough nursing school slots to train the nurses who want to go to school. And so we have a nursing shortage. There are a number of other things like that in the bill, but those 3 things are really the pillars of this legislation.